We had done work at APL a number of years ago in looking at something called statistical shape modeling of the internal organs of the human body. This was really focused on warfighter protection and assessing the fit of body armor. That becomes a predictive model to then guide different types of interventions. So then we began to think, can we not just use this for protecting and sizing body armor, but actually guiding medical interventions or procedures.
Ultrasound has been around for a while. However, recently it's getting smaller and smaller and more portable. It's more feasible that we could actually field it to our far forward medics so that they could use it. But when you do that, we need to provide them training on how to use it. And so that's part of what this study begins to look at is if I hand you an ultrasound probe, how do I make sure you're using it effectively from the get-go?
So the project that we're working on is to develop a mixed reality-based guidance system for performing a ultrasound-based trauma exam.
To do that, you're going to take our ultrasound probe and you're going to put it on a couple of bony landmarks on their body, their sternal notch and their right and left hip, and that's going to help the holograms lock into place on their body and their anatomy. Then, using voice commands, the system is going to step you through how to do an EFAST, extended focused assessment, sonography for trauma, ultrasound exam to put the probe in different positions on the body to check if there's internal bleeding or a collapsed lung.
As we've developed this device, we're focusing it on a mixed reality system. One of the benefits there is, you're not doing context switching where you're looking back and forth at a computer screen. Everything is sort of directly overlaid. And that's something that is likely to be extensible to other types of augmented reality or mixed reality headsets in the future.
The Global Health Mission Area has been working to fund work that helps novices provide complex care at scale. And this has been one of those efforts where we have looked at how we can use the latest and greatest in technology, such as augmented reality, to help a user navigate how do you do something like a complex trauma exam. Once you figure out that you can see where the body is and it's giving you this feedback to say like, okay, place your ultrasound sensor here, and it tells you how to move it. It's really cool to be able to see how novices can quickly provide an exam with very little training and just a little bit of guidance on what to say to get the system to respond correctly.
Right now, we've been focusing on anatomy for trauma exams, looking at the thorax and abdomen. However, one future application we could look at is our warfighters are not just experiencing trauma, they're also sometimes twisting their ankle or hurting, something more routine. And so one direction we could expand to is looking at musculoskeletal ultrasound and can we help assess those more day-to-day common injuries as well.